Hi, I'm David Terra of the Agile Elephant. This is a summary of a report and recommendations that we produced for NHS England and NHS Improvement on the AnalystX Community. Sigmeet Panesar asked us to put together this report at the end of 2021. So Alan Patrick, Janet Parkinson and myself, we interviewed a whole range of users both inside the NHS, non-NHS users and from strategic partners, and we evaluated, benchmarked the community you were creating against other similar data communities around the world. So here's the story. You started the community on 17th of March 2020, just before the first lockdown and just after the pandemic had really hit. And the intention was to actually create ideas and innovation by connecting together data scientists and data analyst expertise and people who wanted to learn about those topics, both inside and outside the NHS, and get them together to work together. The initial intention was quite modest. If 50 or 60 people had actually joined the community in the first month, you would have been happy. But actually, at least 1,000 started in the first month, and then 1,000 more added each month for the first 12 months. The rate of growth has slowed down now, but you're still growing, and it's hit 16,000 by the end of 2021. It's broken down cultural norms in the NHS. It's actually got people, collaborating and co-creating in ways that you haven't done before, and it's been an enormous success. But actually talking to people now, although the reason for being was very clear right at the start in terms of we've got this pandemic to actually tackle, let's get together and work on it. Now the kind of purpose and the strategies become less clear. You started with a kind of a 5-box model in terms of a design for this collaboration website, and it's built on a collaboration platform that you use across the NHS called Future NHS. But we think actually you need to do a rethink and a reset and shift from that 5-box model to, we think, a learn, ask, share, accelerate model. We call that the laser model, and redesign the website and the mechanisms around it, around that revised approach. We think that you can actually enhance the thing with a better champions program and get the level of engagement and the learning and the development and the upskilling of people by actually getting more motivation into becoming a champion and what you get in terms of out of that. We think that you need to improve the senior sponsorship of the community, and actually that will promote engagement. And we think you can invest 6 to 7 full-time FTEs into actually building and growing this community. And actually, when we look at what you've achieved, the actual business case and the return on investment, this is adding significant value for you, and you can afford to invest in the community to make it even better. We think that in terms of what it's doing, it absolutely aligns with your goal of putting data and digital and technology at the heart of how you transform health services for the future. And the ROI numbers absolutely support investing in this community and growing it. And we think that it has the potential to become the go-to place for analysts at all levels of expertise to learn and co-create and make new things happen together.